Good morning, good afternoon, everybody. This is Lisa Stromquist from CAPHC. Thank you all for joining us this morning. I would like to pass this off to Tracy Wrong.
Welcome, everybody. This is Tracy Wrong. I'm the Director of Quality and Safety at Children's Hospital of Eastern Ontario in Ottawa. And welcome to the CAPHC Patient Safety Collaborative monthly webinar. And on behalf of my co-chair, Darlene Bolivar from the IWK in Halifax, we look forward to hosting a really interesting conversation today. Just a little bit about the Patient Safety Collaborative. For those of you that might be new to sitting on these webinars, we are a group of always interested and strong champions for patient safety in pediatrics. So we're representative of CAPHC members, and occasionally have some other visitors online. We meet monthly and talk about a variety of patient safety topics, and also have the opportunity to connect, hopefully with many of you face-to-face at the annual Patient Safety Symposium that's held as part of the CAPHC conference as it moves across the country from year to year. So we look forward to connecting with you either monthly or even in between as the opportunity arises. So feel free to definitely reach out if you have any questions or interest in any of the topics that we're presenting as the year goes on. It is my pleasure today to introduce the topic, the Families as Partners in Patient Safety Committee, which...
The broadcast is now starting. All attendees are in listen-only mode.
Okay, now we're being recorded, but anyway. So this was created to actively engage and empower SickKids staff and family advisors to identify, influence, and take action on a wide range of patient safety issues. So along with Rita from who's Quality Analyst and Patient Safety Coordinator at SickKids, we have a group that are going to lead us through a presentation, and Jennifer August is going to introduce the panel that's at SickKids in Toronto right now getting ready to present. Jennifer herself is a mother of 2 young girls. Her oldest daughter spent the first 6 months of her life at the Hospital for Sick Children and continues to be a regular visitor at the hospital. Jennifer has been a family advisor at the hospital for the past 6 years, first as a member of the hospital's Family Advisory Committee, and for the past 4 years as a member of the Family as Partners in Patient Safety Committee. She's currently co-chair of the I have a hard time getting that out, clearly, the Family as Partners of Patient Safety Committee, and in her other life, she's a lawyer who practices constitutional law in Toronto. So at this point, I will pass this over to Jennifer and Rita in Toronto and allow you to carry on with the presentation.
So thanks very much. Hello, everyone. This is Jennifer August, and I apologize for my voice. I'm a little bit croaky today. I don't usually sound like this, I'm happy to say. So let me begin by just introducing some of the other members of our committee who are going to be participating in this call today. So Rita Damignani, who is a quality analyst and the patient safety coordinator here at SickKids, is with us. She's also my co-chair on the committee. Trey Coffey, who's a pediatrician and the patient safety officer for the hospital, is here. Andrea Fretz, who's a child life specialist. Sarah McBain is the manager of our family center. Lori Hagan is the clinical manager of the multi-organ transplant and medical specialties. And Deena Katz, last but not least, is the manager of our child and family relations department. So I can begin to speak about it while we search for it. So the phrase, children stay safer when their parents and caregivers are informed and involved in their care. This is a statement that we use a lot in our material. And I think, it's a great failing of our modern healthcare system that we didn't recognize this fact until very recently. So as a result, a very powerful resource for improving patient safety was left largely untapped. I think there are 2 reasons why families are a very powerful resource for improving safety. On the one hand, we know our children best. Parents know their children best. And we are also a very highly motivated group. Now, like any parent whose child has had a long and involved interaction with the healthcare system, You know, I've had good and bad experiences, but one thing that's been common throughout all of those experiences is that my perspective is always a little bit different than the healthcare providers who are taking care of my child. You know, I see things slightly differently. Sometimes I see different things, and sometimes I notice things that they don't. And I think if you think about it, it makes sense because I do know my child best. So how does our committee fit into all of this? The Family as Partners in Patient Safety Committee, which is a bit of a mouthful, was created to actively engage and empower sick kids, staff, and families to identify, influence, and to take action on a wide range of patient safety issues. So some of the areas that we've worked on are falls, patient identification, safe sleep, handover, pressure ulcers, and hand hygiene. Another important issue that we have done work on is communication. And now I think that improving the quality of communication between patients, families, and healthcare providers, both inside the hospital and outside, is really fundamental to improving patient safety. And, you know, there are very interesting studies out there that show that parents are more likely than healthcare providers to identify those communication breakdowns that can result in adverse events. So we know that there is a very valuable source of information out there to be mined. So how do we want patients and families to be involved in safety? Oh, well, I'm glad to hear it. All right, so we'll improvise here then. So moving on to the next slide then, our committee recognizes that patient and family involvement includes a couple of things. So the first of those things is actively working together with staff to safeguard their own well-being. And it's funny, when I looked at this morning, I realized it's worded a little bit strangely. So when we talk about their own well-being, we are referring to patients there. A couple things I just wanted to say about this. You know, we often use words like partnership and collaboration, but I think we need to go behind those and, you know, really ask what makes a good partnership work. And I think it's a couple things. I think it's mutual respect. I think it's transparency and the forthright sharing of information. I think it's having common understandings and a common goal. And I think we all have a common goal, but I think those other areas need some work, and that's where our committee comes in. The second area that we've identified is participating in the identification of safety issues. So we know that families are this untapped resource, and part of what our committee does is to try to tap that resource. And then finally, the planning of improvement efforts. So, you know, the reality is that safety improvements are more likely to be successful if families are involved in planning them. And involving parents, patients, and families in safety issues isn't just about checking off a box. It's about changing everyone's perspective about their role at all stages of the process. So when their child's in hospital, do we ask them if they have specific safety concerns about their child? Do we involve them at an early stage in the planning of safety improvement initiatives? And I think we need to be constantly mindful that it's really about the quality of the interaction. And I can tell you that as a parent and as a family advisor, if you approach me in that way about improving my child's safety and about improving the safety of other children in the hospital, that I'm going to be there and I'm going to be fully engaged, and that that's going to be worthwhile. So let me move on to the next slide. Who are we? So our membership is, we have the two co-chairs, myself and Rita, so one family advisor and one staff member. We have 4 family advisors in total on our committee, and then we have quite a diverse staff representation, which I think is part of what makes the committee work fairly well. So we have representation from a number of different areas: public affairs, child life specialists, infection prevention and control, the patient safety officer, who's also a physician, the Family Resource Center, child and family relations, inpatient ambulatory managers, and allied health professionals. So, oh, I've gone so far. There we go. All right. So we're a subcommittee of the Family-Centered Care Advisory Committee, which is a broader advisory committee here at the hospital, and we give monthly reports to that committee about our activities. We also have an annual joint meeting with the Children's Council, which is one of my sort of favorite things that we do, and we give an annual report to the Quality Management Council here at the hospital. So that's sort of an overview. What I'm going to do now is turn it over to my co-chair, Rita, to tell you a bit more about our work.
So, the role of patients and families. We have been doing this for a while now. In fact, in 2006, there was a paper published by SickKids Patient Safety in the Pediatric Center partnering with families, and that was before my time. But there's some really great literature out there that we've been able to refer to as well, and I've just put some examples of some of the white papers and some of the evidence scans that are out there that have really helped us or led us in terms of understanding and being very clear on the role of patients and families and how we can work collaboratively. And Powerful Partnerships was just a nice piece as well that was available to us in terms of how do we engage our partners and how do we describe their roles and make sure that we have the right people at the table. So there is some good work that's out there that's been helpful to us as well. Now I will advance. Perfect. Okay. So one of the things that we found very helpful to do in terms of keeping us on track as a committee was to set an annual work plan for ourselves. And the reason for that is that it keeps us very focused. We only meet once a month. Everybody here is doing very busy jobs, and you know, we need to really stay organized and focused. So I found that if we could stay with the work plan, it would also prepare us in terms of what we were thinking about in the new year as well, and it stimulates us to think about what's going on in the hospital, what's going out in the world at large, in other hospitals, and what can we do, and how can we network and work with other people and make sure that if people sit on other committees, how can we influence those committees so we have reports back and things like that. The other advantage of the work plan that I found as well was that it really helped us look back at the year and sort of say, hey, we have done quite a few things. And, you know, I think even when we were putting this presentation together, we were looking at the number of slides and saying, you know what, we have done a fair bit of stuff, but when you're working slowly at things, you sometimes forget that. So it's really important to have, we found it very important to have a work plan as well. And then based on the work plan, I was able to create some highlights of the year as well. So when I report, just recently we gave a report to our Quality Management Council. And again, it was much easier for me to go and look at the year past and put down the highlights as well. So that was very helpful tool for us. Now, Jennifer talked about the role of families, and we really identified basically three different roles of families, and you'll see on the left-hand side of this table those roles. So in terms of the role of family, in terms of actively working with staff to safeguard their own well-being, we've looked at what some of the highlights or some of the activities that we've done over the year to address these opportunities. So we've created a lot of patient safety related pamphlets. So education, of course, is a big part of our committee. And we started by creating, I'm going to move to the slide to show you this. I'll go back and forth a little bit. We started creating our slide, our pamphlet, Keeping Your Child Safe, Your Visit at SickKids, and that's sort of the mother pamphlet with all the different aspects of patient safety and how families can be involved in terms of patient safety. But then we also started to create pamphlets that would specifically address patient safety initiatives at our organization as we came across these. So for example, when we were working on our falls prevention initiative, we designed the falls prevention pamphlet to engage patients and families in fall prevention. We also developed our Speak Up, I think it was during Canadian Patient Safety Week, we actually launched our Speak Up pamphlet. We were working on safe sleep and falls prevention here at SickKids, and we really wanted to get information around safe sleep out at SickKids. So we really created these tools, and we were very specific about what kind of tools, what they look like. Originally, when we had our first pamphlet, we used photography that was stock photo. And the feedback that we got is that, we would really like to show sick kids, show the faces, the images, the people, the patients. So the rest of our pamphlets actually got bigger, sort of better in terms of we were able to do some photography and get shots of our own environment, our own people in those shots as well, which I think we got feedback that that's very valuable. And people take real pride in being part of these and sharing this. So that was some learnings for us. And the other thing that I feel is unique to this committee is that we spend a lot of time around the wording. And I think that shows that the words mean a lot, is that how one person sees it, another person sees it quite differently. And I can tell you the family lens is quite different. Oftentimes I've looked at something and I think that's perfect, and then we'll get a reply back from the family advisors and it's like, I didn't even see that coming. So it's really, really valuable, and sometimes you don't realize just how much different people see things from their view. The other thing that we have in terms of education and keeping families and patients up to date is we do have a patient safety website. On our patient safety website, actually, we have information about our patient safety indicators, about our Families as Partners committee. We actually have information about recruitment for our committee, and our patient safety pamphlets are available on that website as well. So the other, in the column again, the other way that patients and families can be involved is in participation in the identification of safety issues. So I'm going to show you again some examples of what we've done in terms of this. We have a patient satisfaction pamphlet called How Are We Doing? And incorporated within that pamphlet is a question around patient safety. The question that is asked is, I don't know if I have that here, but we say the safety of your child is important to us. How can we improve? And so we're able to look at what families are telling us. And it's been interesting because what was always at top of their minds when we asked them about safety, it was always about security. But we feel that there's a change that's happening. We're seeing more reports back from families in terms of concerns around communication, concerns around the spread of infections, equipment availability. So we are really seeing a change in that respect as well, which maybe we take some responsibility for, who knows, but it's encouraging to know that they're aware of other issues that exist in the hospital with respect to patient safety as well. We did a little exercise as well in terms of identifying safety issues. We have a process here at SickKids called Quick Picks, and one of our committee members is really good at facilitating these quick picks in our organization. So we said, why don't we do a patient safety quick pick and go out to the families and ask them what their concerns are. So we created a survey that families could fill out. And so representatives from our committee went to ambulatory services and had these conversations with families and to ask for their input as well. And again, we're seeing similar things, that they're much more aware of patient safety concerns that exist out there. I'm going to go back to, oops, no. Yeah, so the other way in terms of identifying safety issues, again, our collaboration with our Child and Family Relations program, I think is really important in terms of Deena and Miranda can bring back to us some of the concerns that families may have that are patient safety related. Again, we have this cross appointment with the Family-Centered Care Advisory Committee. We have representatives from our committee that sit on the FCCAC so we can hear and share patient safety concerns. And I told you a bit about the patient safety quick picks, so I'm going to move on. And the third way that families can be involved in patient safety is planning of improvement efforts. So in this respect, our Families as Partners in Patient Safety Committee has been very engaged and has a real impact on the planning of the annual Pediatric Patient Safety Symposium. In past years, we've had some great speakers. For example, 2 years ago, we had Juliet Schlechter coming from Children's Hospital of Philadelphia, And she was really influential for us, helped us in terms of how we were operationalizing things, and was a really great expert in terms of helping us and moving us along. Last year, we were very fortunate to invite Denise Hudson and Doug Cochran from BC Children's Hospital, and they were able to share with us some of the great work that they've been doing around parent or family safety reporting. And this is something that we've always been really, really interested with, but we were having a hard time getting some traction or getting moving on this. So based on what we learned at the Patient Safety Symposium and the great work that we heard, the whole organization heard about the value of safety reporting. And so we were able to get engagement from the organization, and we have a pilot that's happening in our critical care unit at the moment. So we were pretty excited that some of the work that happens there actually gets some tractions and gets translated into our, so we feel very happy about that. This year we're also really excited. We're excited about this year's event, which will be our 10th annual Pediatric Patient Safety Symposium. Because it's our 10th year, we're also combining with Risky Business, which is an international safety symposium, and it's going to be happening May 15th and 16th. And I'm excited to say that we have confirmed that Suzanne Gordon is going to be one of our key speakers. Suzanne Gordon is a journalist and an author. She presented at the National Patient Safety Foundation last year, and she's going to be presenting her play called Bedside Manners, which focuses on communication issues that can occur between healthcare providers and patients and families. So we're very excited about that this year. Just quickly, too, at the symposium, we take the opportunity to we have a poster session, and we acknowledge a Family-Centered Care Award. And so, again, it's just recognizing the work that happens with family-centered care and patient safety. And it just happens that last year, one of our runners-up for the award was the Child and Family-Centered Care Project here at SickKids, Implications for Patient Safety. So I'm now going to pass it over to Laurie Hagan. Laurie Hagan is our clinical manager and a representative on our committee.
Thanks very much, Rita, and hello to everybody listening. So I am just going to very briefly describe what I see as the mutual role. There's beneficial components for clinical management to be involved in the committee, and obviously for us to bring back any concerns that you would typically refer to as the nursing manager role. Now it is described as the clinical manager. So we, as managers, are collectively invested in day-to-day patient safety issues and concerns. This is part of our daily business, so certainly we're hearing back from families and patients very often. So it's nice to be able to discuss that in this kind of a forum with some consistent family advisors. I would hope, and I think I speak for the clinical management team when I say that we're able to inform discussions within this committee. We can bring ideas, discussions, planning from a different perspective, maybe at times. Maybe it is operational, whether or not it's a can do or should do. And also we can bring a lens around resource intensity and allocation. So I'll just briefly again highlight some examples of my involvement. We were able to get some feedback from the committee and in helping us deploy the family-centered medical rounds, which was a largely supported initiative that was based obviously in family-centeredness. I also think that we're able to really share lessons learned from both inpatient and outpatient experiences, and we are privy to many safety reports that come kind of across our desk, and it helps inform these discussions within the committee. Managers are very often leading multiple quality improvement initiatives, so this committee allows us to, again, share that with the multiple members, get feedback, and certainly, you know, what I would consider vetting the work, so to speak, from this committee and the committees we report to. So to highlight just one of the things that I was involved in specifically was the ID band initiative. I joined this group right when this became a concern for me. I happened to be on a unit that was doing very poorly at having ID bands on their patients. So it was helpful for me to have family FPPS, you know, certainly supporting just the discussion around how can we move this forward. And then I had access to the stakeholders that I needed. So public affairs, creative services were really kind of key in getting the work done, and then the messaging around that. Child life, we solicited some bedside nursing involvement just for really the framing and the language around how to reach our nurses and how to reach the patient and family in an effective way. So it did work out very well for us. We were able to get some executive sponsorship just around communicating it, also kind of supporting the work of the committee, but supporting the work of family-centered care in general across the organization. This is where we landed. There were two distinct messages. So one was directly to the patients and families, and the other was to the nursing team. So they certainly are accountable and responsible for identifying children before they administer a med or do various things. So our campaign, so to speak, was really it was really kind of dual in that we want to get the nurses engaged, but we also would really love for patients and families to be involved in asking the questions. So I will leave it there and pass it on to Sarah.
Good morning, everyone. So I'm the manager of the Family Center here at SickKids. There we go. You can see the Family Center pictured in the bottom of this slide here. And the Family Center is, amongst other things, the consumer health information library for the Hospital for Sick Children. So we do distribute a lot of the pamphlets that Rita spoke about before that were created by this committee. And of course we know that how hard it can be to get information out to families, even when we create something really high quality in a large organization like our pediatric center. It can be really difficult to make sure that those resources are getting into the right hands of the people that we want to make sure have that information. So we have a couple of strategies that we use to do that through the Family Center and through my team of staff and volunteers there. We do distribute a lot of the pamphlets right in the Family Center, so you can see those numbers of those 6 pamphlets there. And we also do something which I think is in some ways even a more effective way of getting the resources out, which is to distribute them through the resource boards in the hospital. So we currently have about 23 resource boards that are stationed in various in and outpatient areas throughout the hospital. So those are actually getting right into the clinical settings where families can freely pick up these resources to read and learn at their own convenience. We do have a lot of volunteers who help us with this, because with that number of boards to make sure that we have stocked, it's a lot for our team, but we have about 30 volunteers who help with various tasks, including this one. And another thing that we really like to do on like special occasions like Patient Safety Week is we use our volunteers to distribute these types of resources directly to patients and families at the bedside, which also allows for a little conversation and a little bit of kind of more of a personal touch. So that's just another way that we make sure that these resources are getting to the people who really need them. And I'm going to pass it on to Deena Katz.
Thank you, Sarah. Hi, I'm Deena Katz. I'm the manager of Child and Family Relations here at SickKids. That's me on the left. My colleague was unfortunately not able to come today. When we look at the research, we see that the research on patient safety really suggests that patients and families become more comfortable to discuss concerns of safety with their healthcare provider if there's effective communication. And really at Child and Family Relations, what we do through coaching, support, and education is to help facilitate this communication between staff, patients, and families to really allow for an increase of engagement and positive communication, which we hope would lead to us hearing about patient safety issues from families. Can we switch the... Thank you. Thanks, Rita. Child and Family Relations is essentially a place for families, patients, and staff to come to discuss their concerns, resolve, hopefully, their concerns. Also, we like to hear about compliments. We also provide education and coaching for families, patients, and staff. and really help, again, to facilitate communication. We really work collaboratively with the patient, the family, and the staff, as opposed to reactively when patients bring concerns to our office. We work definitely from a family-centered care perspective. We have quite a transparent process in terms of how we address concerns that come to our office. We really advocate for a positive process where patients and families are working together to address the needs of the patient. We also have a database that can track this feedback that comes to our office, and that also helps us to begin to identify concerns that are specific around patient safety, and we're able to really look at those trends. So when we take a look at the last fiscal in terms of the types of concerns that are coming through our office, we see that consistently the top 3 concerns are around care and treatment, communication, as well as interpersonal. This past fiscal, we do have a little blip around parking, and that's unfortunately as a result to the increase of parking costs. But outside of that blip, consistently we are seeing care and treatment, communication, interpersonal. When we look at care and treatment, we see the kinds of concerns around patient safety, maybe about medication, availability of care, as well, maybe the quality of care and the impact on the patient. And I think communication and interpersonal are two really big ones, because in order for patients and families to feel comfortable and able and feel like they have the capacity to bring forth their concerns around patient safety, there has to be good, positive communication and a good relationship. And that's really the trend that we're seeing that's coming through our office. And then being a part of this committee has been incredibly helpful for us, so that we as a team are able to understand the issues around patient safety and can really help the patient and family communicate in a way that's positive and effective with their healthcare team. Thank you. I'm going to pass it on to my colleague, Andrea, with Child Light.
Hi everyone, I'm Andrea, and I'm a child life specialist that works here in ambulatory care and cover outpatient clinics for the child life department. And I just thought I'd start by offering a little bit about what child life is and what we do for those of you that may not know. So child life specialists work to educate children along with their families about their illness, hospitalization, and procedures in general, to help provide direction and clear up any misconceptions that may be taking place in regards to their hospital environment. So as allied healthcare staff and working direct to frontline, it's been really helpful to be part of this committee to offer the perspective of the child at our meetings. So in general, child life specialists throughout the hospital work with inpatients as well as outpatients to strive to reduce the impact of stressful or traumatic hospital experiences. And this is done through preparation, offering coping strategies, distraction, normalization, and overall psychosocial support. And one of the biggest things that Child Life does in general is that we use play as a tool to offer assessment about a child's response to hospitalization, as well as their understanding of medical procedures, illness, and the environment as a whole. So with that said, one of the biggest things that has been, I think, a great addition to being on this committee is that a big part of our role is to advocate for children and their ability to participate in decision making throughout the hospital. And I'm fortunate to be one of 3 co-facilitators that work with the Children's Council. The rest are other colleagues of mine. And the Children's Council has been a huge help in getting some of the important pieces that have been identified already in our presentation to the kids in a child-friendly way, and engage them in some of these things that we've been already talking about as far as patient safety. So, of course, it goes without really saying that advocating for participation offers children the opportunity to gain a sense of mastery and some control within their hospital environment. So that is really why Children's Council was created. Here at SickKids, we definitely really do feel that the child's voice is integral to our decision making. And I think the council's been around for just over 10 years now, and it's made up of about 15 members, and we have children from about the ages of 12 to 18 who are either current or past patients here at the hospital, and they are nominated from either parents or other staff. They can even nominate themselves, and they go through sort of an interview process with the current members as well to become part of the council and be able to offer a voice to help others that are in the hospital. And they come with a wide range of experiences, both inpatient and outpatient, whether or not it's short-term or long-term, chronic or acute illnesses, and many very enthusiastic with personal experiences and ideas to offer perspective on making changes that are better for children and families here at the hospital. So we meet once a month as well, and often have staff come to our meetings to offer some insight to new project ideas that are starting up here at SickKids, and of course taking the child's perspective into consideration. The council will then offer their opinion about the projects to ensure that what the committees here at the hospital are doing in order to do what's best and most needed for the kids. So some of the projects that the council has been part of specifically related to patient safety have been engaging the kids in wearing the ID band, which has been challenging. Not a lot of kids like to wear that ID band, but the council helped us come up with some ideas to make it a little more fun, as well as hand washing and speaking up. And some of the ways we've done this is connecting with them on hospital tray meal liners, so we can send out sort of activities that are interactive and offer a way to educate the importance around some of these topics, as well as through our closed circuit television channel we have here at SickKids, which is what's pictured here with actually Rita on the left, and this is our therapeutic clown, Ayla Boo, where we created a short commercial to explain the importance, and it was quite funny, and you can see there, that's the link if you'd like to take a look at SickKids Interactive and watch the video after our presentation, feel free. But it really was a great way to connect with kids in a friendly way, to offer the importance. This was actually done during our Patient Safety Week around wearing an ID band. We've also had them help us come up with some themed activities around some of these topics to engage kids during their time spent in our playrooms. We have a couple of lounges where it's accessible to all patients and families, inpatient and outpatient, so we might do themed activities in there to offer some insight to this as well. And again, we really do appreciate their ability, obviously, to speak from their perspective to make these topics fun and exciting. So hopefully you'll take a look at the commercial, and we actually will have a couple of more coming up, I think, I'd say in about a month or so, related to this as well, short little commercials for a closed circuit television network. And I think I'm passing it off to Trey now. Thank you very much.
Okay, thanks everybody. I wanted to share this one example, and it's just one of many, but it's a project that I have found so educational, and I think this one anecdote just so well illustrates, going back to what Rita said about the importance of how we say things and how challenging it can be from a healthcare provider standpoint to predict how our language might be responded to by a patient or parent. So a while back, we embarked on a set of projects around skin burns relating to interstitial IVs that had come up in safety reports and M&Ms and so forth. And it was a really novel project where Rita and some folks from the Learning Institute and from inpatient pediatrics partnered to do a simulation to kind of diagnose problems around IV care. And it was certainly a multifactorial situation. There were some gaps in knowledge and skill, but something that we kept hearing repeatedly was that staff were very hesitant to do thorough checks at night because of the fear of disturbing children. and sometimes assuming parents wouldn't want this, and other times being asked by parents not to disturb children. And so we identified that among the different ways we would tackle this problem, one way was to better partner with parents and families around how we do care overnight to facilitate proper IV checks so that we can identify and respond to interstitial IVs as quickly as possible. And so one thing that we thought we would do is we would create a script, and we actually had a master's student who's now at Montreal Children's, Nadine Cora, and this was one of her projects that she took leadership on, feeling that if we would do staff education in the form of in-services or OSCEs, that we could include this little script as a way to kind of bundle this communication piece with the sort of technical aspects of IV care. And so Nadine went around and spoke to some frontline staff about, so what would you say to a family if you were introducing the principle of these hourly IV checks, especially going into a night shift? And one of the things that kind of came forward was that people would say that we have a policy that we have to check the IV site hourly, and that they might tell the family that the IV could leak and cause a skin burn. And so we invited Jennifer, whom you heard from at the beginning of the webinar, to work with us because we recognized that this potential script needed a lot of improvement. And in about a half an hour with some nurses, managers, Nadine and myself, but mostly with Jennifer's input, we came up with this much improved script, which I think you'll all agree sounds much better. The emphasis is to keep the child safe. So, it might be off-putting to say something scary like a skin burn, but you still want to be transparent that there's a risk to their safety if we don't do this. And then, Jennifer advised us to really speak to exactly what we were going to do, but in really simple language, come in and touch and look at the IV, and put the focus on, symptoms like swelling and pain as opposed to something scary like a bad skin burn. And then we worked on trying to enhance the language around demonstrating to families that we are trying very hard to minimize disruption to sleep. And so linking right into the script the techniques that we were going to do, like use the flashlights that we had installed on all the doorways, and that we would actually engage them in helping us decide how to bundle the child at night, for example, leaving arms and legs exposed, so that instead of an adversarial situation of coming in to disturb the child, it was like partnering with the parent to ensure safety around the IV care. So now I'm going to hand back over to Rita.
All right, so this is our last slide actually, and it really is around opportunities and next steps. So I won't dwell too long because I know we wanted some time for questions and we got behind a bit. But I guess some of the challenges we have that were probably other committees have is that we don't really have much of a budget. Although when we go to people for support, they're more than happy to help us with printing and things like that. We need more representation at the table. We need more family members, but we've been struggling with that a little bit. Juliet told us that our numbers should be more representative of families and staff, so we need to work on that, and we have been trying to work on that. So lots of opportunities for improvement, but lots of work to anticipate ahead, but I'll turn it over now for questions.
Hi there, Lisa. How do we want to manage some of the questions? I'll leave it to you.
Sure. If anybody has, yeah, sure. So as people have been doing throughout the presentation, if you have any questions or comments, please type them into the control panel, the question feed on the right-hand side, and we will read those out and get our team to the SickKids team to answer those. There might be opportunities to unmute people's lines, but here we will, I'll start with some of the questions that we have in. So Catherine is saying, I'm interested in how much staff resource
Cheryl's going to have to help us.
Is dedicated to child and family relations and in the resource center, and how that plays out in relation to ability to focus on initiatives, work, and the data collection, etc.
Okay. Sorry, we just, I have the headset on, so I'm just going to have to translate that to both Deena and Sarah. So the question was around available staff resources to family and child relations. What kind of resources are available to to both your programs. And what was the second part of the question?
And how that plays out in relation to the ability to focus on the initiatives and the work.
And how that plays out in terms of focusing on the initiatives and the work that we're doing. How it translates to some of the resources. So, yeah, we're just going to.
Hello?
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 Hi there. Are you still there? Hello?
Rita?
SickKids on the line?
Oh, I don't know if I can. Okay, so we're just trying to get it.
Yeah, we're just trying to see if we could take the headphones off, but.
Okay.
Oops.
Yeah, that works.
Can you hear us?
Yeah,
Yeah.
we can hear you.
Okay. I'll use the headphone right now. I'm just going to pass you over to Deena. Yeah.
Hi, it's Deena from Child and Family Relations. At present, we have myself, who's the manager, Miranda Vermeer, who's the coordinator, and over the past probably 2 years, I've been in the role for almost 3, but over the past 2 years, we've initiated a student program where I'm a social worker by profession, so I have a master's social work student on an annual basis from September to April who assists with the work. As well, we've just recently had a nursing student, which we will continue to coordinate with the nursing schools to have that on an ongoing basis. And as well, we've sort of been creative in implementing a volunteer program whereby we have 2 to 3 volunteers from particular programs, university programs that we think are a good fit. So that's the long answer. The short answer is we have two people in our office, and we're finding creative ways to be able to address the work. And I'm just going to let Sarah talk to the Family Center.
Hi, so we have a little bit of a similar situation to Deena in that we're always looking for kind of creative ways to get more hands involved in these types of initiatives. In terms of the work that we do for the Patient Safety Committee, we have myself, so we have a manager, and we have a Family Center assistant who's really integral in coordinating the resource board program that I was speaking about. And of course, we also have I think I mentioned a team of about 30 volunteers that works with us, and those volunteers are absolutely essential to getting the work done that we do for this committee. We wouldn't be able to make the impact that we do around the hospital in terms of distributing resources if we didn't have those people involved. Okay, we're gonna try without the headphones, so just give us 1 second here.
Perfect. I have been forwarding you some of the questions, but Carol is wondering what were some of the actual ideas that the Children's Council put forward to encourage the wearing of the ID band?
Yeah. But they can't hear us. Can you hear us?
Yeah.
I can hear you.
You can hear us. Okay.
Yeah.
We just probably have to talk into the speakers here. Yeah.
Yeah.
Can you hear us comfortably if we didn't try to hook up any speakers or anything?
Yeah, we're good.
That sounds good.
Okay, great. Good. So, next question.
So, did you hear that? What were some of the actual ideas that the Children's Council put forward to encourage the wearing of the ID bands?
Good question. Andrea can answer that.
Okay, so some of it was around language, for sure, offering some support on how to introduce the reasons why, again, in a very simple manner. Trying some of the unfortunate feedback was that they wanted something completely different, because a lot of what happens is that it's uncomfortable, and I think that there was a process put in place to start looking at some of the different types of ID bands that possibly we could have that were a little more comfortable, as well as just making it more child-friendly, offering opportunity to put stickers on it for younger kids, and then again trying to make it more of a engagement thing where all the other kids are doing it, try to make it fun, in the sense that a lot of kids are wearing the elastic bracelets and things like that, and saying you have to go check out the other kids down the hall because sometimes they're different colors and things like that, and just trying to offer some ways for whoever is putting the ID band on to engage the kids in that sense.
We also got, I think we talked to our partners, our rehab partners at Bloorview, and they had some great signage that was created that made it look a little more fun, and their poster was ID me, so the idea of wanting to be ID'd was there something. So they do have some good ideas for sure. So we definitely borrow from other organizations as well.
I have a question here from Barb. Did you consider empowering parents to look for the signs of leaking IVs?
Did we empower parents to look for signs of
the leaking IVs? Yeah. In that particular project that Trey had spoken about.
I don't think we are intending to target families directly in identifying them, but I think we're trying to help staff educate families about what's normal and not normal. And so one of the key messages is it's not supposed to hurt. So both parents and staff need greater awareness that we need to be able to tell the difference between a child who's bothered by the IV being there versus a child who's reporting new IV pain, and we need to respond really quickly to new IV pain.
Okay. So I have a few more questions and comments. We're getting right to the top of our hour, though. So are you exploring the ability for parents to have real-time access to their child's records and the ability to contribute to them?
I think I'm not sure that we have an expert around the table to, but actually Dana says that that's the good thing about having this diverse network. Dana has some experience.
We definitely get a lot of concerns in our office around families being able to access records, so we do a lot of work around educating how. I think one of the biggest concerns is families don't know how to access the record. As far as real time goes, we're also doing a lot of education with staff. I think staff typically get reactive when families want to see the healthcare record and aren't quite sure how to react to that. So we're working with staff to support them in terms of ways that they can provide the record. And if it's an inpatient, if the patient is on an inpatient unit, then helping the staff and supporting them to sit with the family and go through the record with them. I think staff typically react feeling like they're not allowed to give that information, and so we're doing a lot of education around the fact that we can, and there are ways to do that. If it's an electronic record, we're helping staff to support families in terms of how to access that electronic record through our health records department. So I hope that answers the question a little bit.
Yeah. I believe there are some pilots. I'm quite sure when I sat in at one of the Family Center Care Advisory Committee meetings where there is a pilot for families. So I think there is some research and work being done, developmental work, but it's still early stages, I think. But although the electronic patient chart is something that SickKids and others have been early into, and your point is well taken. I think that we identified that staff are sometimes feel like that patients can't have the chart, and yet it's their personal health information. So there's a lot of statutory right, as Jennifer with her law background will tell us very clearly here. So
I think it's about supporting and educating staff so that they're aware of what they can do and what the patients and families are, entitled to, and how to support the patient and family through that process.
Correct. Thanks, Dan.
Okay.
I just have a couple of more comments and one more question, and then I'll probably pass it over to Tracy. So there's been a lot of sort of congratulations and a lot of support for what you're doing across the country. A lot of comments have come in thanking you for the presentation and congratulating you on all your hard work and asking for copies of your slides. And the final question would be, would you consider the option of borrowing patients or family advisors from other organizations to support your projects? Do you know if this is done anywhere, or is this a viable option, do you think?
Are you referring to other children's hospitals, like family advisors from other, or children's councils from other hospitals collaborating more, like across pediatrics across the nation?
Yes. Iwana, I've unmuted your line. I'm not sure if you have a microphone. You could probably speak a little bit to your question.
Okay. Hello, everyone. Yes, I think you can hear me.
Yeah.
Yes. Okay. Yeah, other children's hospitals or other patient networks that have members who experienced care or an incident in a pediatric setting. I'm asking because I work with Patients for Patient Safety Canada, which is a network of patients and family members who experienced the patient safety incident, and quite a few of our members had their experience in a pediatric setting. So when you're short of hands on deck, is there an option to connect with other patient advisors and get their support if they're interested, and if it is a good fit, to work together to get something done?
This is Trey. We're all nodding vigorously because we all recognize this issue. I think two things. One, we would like to make a plug for a program called pipsqueak Ambassadors, which is a parent and family-led arm of pipsqueak that intends to do just that, to help sort of capacity build through networking. So I would encourage people to check that out or get in touch with us if you'd like to know more about that. And then we're also very aware of external patient-led organizations, some of whom have family members who have a lot of longitudinal experience in our hospitals. And we recently had a roundtable with representatives from Patients Canada. And I think the value in that is that, you know, we're on a course, but it's a rapidly moving target to do things that are more forward-looking and more ambitious. So I think it's great to stay in touch with those organizations to keep us on our toes and keep us pushing forward.
Okay, we're here for you.
Good. Yeah, you want to say that? Yeah. Okay.
Okay, so I think it's at this point, it's Tracy again, that I should jump in to bring this webinar to a close. Want to really thank our friends at SickKids, and I mean, really, your presentation's been illuminating, and it really does show that you do have your families as partners in patient safety. One of the things that Jennifer mentioned at the beginning was just sort of highlighting how we need to help patients and staff and physicians understand the changing role of families, and it's part of a process, and really to do that, it's not just ticking off a box. And that kind of resonated with me because I think that, you know, if you think that you're involving patients and families in patient safety by just sort of being able to say you spoke to them and ticked off the box on your checklist, that's not really what I think we're actually aiming towards. So I think this has been a really good example, really comprehensive one of some of the great work that's happening at SickKids. So thank you all in Toronto for your great contributions there. And my final words would be, I guess our next Patient Safety Collaborative call is on February 28th. If by chance anybody has any suggestions for future presentations, we do love to hear ideas, so by all means just get in touch with Lisa Stromquist at the CAPHC office. And also watch for the CAPHC Presents newsletter, because that'll be providing information on all of the CAPHC webinar presentations and where you can find the archived information. So thank you very much, everyone. Thanks again to SickKids for your great work, and we look forward to getting together at the end of February.
Thank you.